Hello there, and welcome to part 3 of our nursing home, long-term care, and senior health video series. Okay, so how has COVID-19 affected nursing homes? The coronavirus pandemic that started in spring 2020 has had a severe impact on nursing homes. The Centers for Medicare and Medicaid Services reported that, as of mid-September 2023, there have been more than 1.73 million confirmed COVID-19 cases among residents of nursing homes and more than 1.70 million confirmed COVID-19 cases among the staff of nursing homes. Around 168,150 residents of nursing homes have died of COVID-19. People who live in nursing homes are usually the frailest because they are typically elderly with multiple advanced chronic conditions. The smallest challenges will have the biggest effect on them because their immune system is very compromised to begin with. In addition, the close contact with others that occur in congregate care settings like nursing homes and skilled nursing facilities means that any infectious disease has a good chance of moving through the population quickly. In an effort to curb transmission, many facilities severely restricted visitation by loved ones, which created a series of added complications and increased feelings of isolation for those residing in nursing homes. In Boston, the pandemic also forced massive changes on facilities. They had to adjust operations to harmonize their practices with the regulations and guidance that focuses on prevention, with the practical capabilities of the facility, the staff, and the residents. While the rules enacted at the height of the pandemic were intended to keep residents and staff safe, they weren't universally adoptable, which created potential liability for some facilities. The fallout from this difficult period continues as the pandemic lingers. One study of the COVID-19 outbreak and response in Connecticut found that the prevalence of symptoms of depression increased by 15% among residents right after the peak of the COVID-19 outbreak. Some facilities have been sued for negligence by grieving families who lost loved ones during the pandemic. For their part, many of the defendants in such suits had pointed to a patchwork of state-based laws that shield nursing homes from liability during certain public health crises like the COVID-19 pandemic, but many suits are still working their way through the courts. All of this has put pressure on nursing homes, many of which have been left short-staffed because of the pandemic and subsequent societal changes. A 2021 survey from the American Health Care Association and the National Center for Assisted Living found that 94% of nursing homes faced staffing shortages. The Consumer Voice noted that staffing standards in almost every state remain severely low. 1 in 4 nursing homes nationally reported a shortage of at least one type of staff. The shortage is so concerning that in September 2023, the Biden administration announced reforms to improve the safety and quality of nursing home care that includes mandates for adequate staffing levels. It's not over yet. As of early October 2023, COVID-19 cases were climbing again, in line with seasonal increases of other respiratory infections, such as colds and the flu. When COVID numbers rise, it could impact whether families are able to visit loved ones in nursing homes in person. Some families might have to go back to virtual visiting and impose strict guidelines like social distancing because of all this. If you're looking for a nursing home or a long-term care facility for a loved one now, or if you will in the near future, take care to do some extra diligence to ask about their procedures and policies regarding infection control and how staff are working to keep residents safe from COVID-19 and other contagious diseases, such as pneumonia. It is also recommended to ask how the facility handles medical emergencies. This concludes part 3 of this video series on nursing home, long-term care, and senior health. Thank you for joining us for this short video series. For more information, or to better understand what your retirement plan could look like, take the questionnaire linked in the video description.